Thank you, Mr. Chairman, and thank you for your comments, your testimony this morning, and for your leadership in various fronts around the country. Some very good suggestions. I think there's some general applicability throughout all of this. As my colleagues know, my lens in this committee really tends to focus on access to care in rural areas. And so I'd like to just present to each of you what you have shared with us is good, but is it workable in a place that is highly rural, where there is very little competition, where access to an MRI is not possible in your community and perhaps not even in your region, and so the effort to gain access to many of the things that others might just take for granted are limited. I note, Dr. Gross, you're in Florida. Ms. Damaras, you're kind of all over the country. We've got Tennessee and in King County. You've got 2 or 3 times more people in King County than we have in our entire state. So can you share with me how what you have learned can also be applicable in high-cost, very low population areas where we simply don't have competition? Or is it an entirely different model? We've had hearings in this committee that are more specific to rural health care, but share with me what we can learn from you as applied to rural access.
Mr. Chairman? So although I am in Southwest Florida, we're about 45 minutes from a critical access rural hospital. And that's actually the area that we partnered with to get bundled surgical pricing. And what that's been able to do is for us to drive elective surgical volume into this critical access hospital that would have normally left this region. So they're actually starting to see inbound, so even a 10% increase in margin for a hospital like this is actually huge. It means the difference between staying open and closing or certain wards. But we've restructured and worked with them to restructure their health benefits program so that they're actually, if their employees sign up for our program, not only do they see a 20% reduction in their premiums, but they'll actually eliminate out-of-pocket costs. And what we're seeing is restructuring. We actually saved that program about $800,000. We're projected to save that program about $800,000 in the first year. Now, if you could transition that savings to the county, the school board, the local prison employees, that has the ability to save that local community millions of dollars in annual costs that can go towards higher wages, can go towards new school facilities or whatever. But instead of spending the money and wasting the money on unnecessary healthcare services, to provide healthcare better with a solid foundation in primary care is a way for them, the rural practices, to actually save money. So using our approach, we've actually found a way, because it's an underserved community. You can't get fee-for-service practices to survive in this environment, but our membership requires a lower barrier to survive in this model. So we're actually not only going to succeed out there, we're going to thrive out there.
Others?
Thank you, Senator Murkowski, for a great question. One of the areas that we think applies greatly to intensely rural areas and critical access hospitals is the use of telehealth services. HCA has over 200 telehealth programs, and we've been able to stabilize essential critical access hospitals by providing telehealth support. So, for example, a stroke patient who doesn't need transfer can stay there and be managed with some guidance. But a patient who actually needs some intervention is the one that, when conditions are possible, can be airlifted out. And of course, we appreciate your support of our Alaska Regional Hospital, and these are the sorts of programs that we think really innovation can help to improve health care and value.
Good, thank you.
Senator Murkowski, the addition I would make is that it is in rural areas, I think, even more important for the buy side of the market, the purchasers, to get together and be able to speak with one voice with the providers that are in that market about what's important to them. An example that I can think of from our region is a relatively rural county that didn't have urgent care services. The purchasers, the employers in that market, approached the local hospital to discuss the availability or making available an urgent care center, and they worked together to establish that capacity in that community.
Good, thank you. Thank you, Mr. Chairman.